Most treatments ignore soft tissue dysfunctions, such as adhesions, scar tissue, and inappropriate fibrosis. Astym and Graston treatments directly address unhealthy soft tissue through an innovative treatment process that years of research and clinical trials have demonstrated to be effective. A certified clinician, following a specific protocol, non-invasively locates and treats the dysfunctional tissue using specifically designed, patented instrumentation. This approach induces the patient's body to respond by initiating the healing cascade. This includes macrophage-mediated phagocytosis, microdebridement, and local release of growth factors that result in an increase in fibroblast recruitment and activation. A customized stretching and exercise program is prescribed to promote optimal tissue healing and collagen remodeling. Throughout the treatment, patients are encouraged to stay active in their work, sport, or daily activities. This is important as it facilitates stronger and more functional tissue and decreases the risk of re-injury. The Astym process works by stimulating the body's healing response and allowing for appropriate alignment of collagen fibers, while the McKenzie dysfunctional model is based on progressive mechanical loading, forcing the dysfunctional tissue to properly align with the appropriate stresses. With the combination of these two methods, Astym initially breaking up the scar tissue adhesions and causing microtrauma to the area and initiating the healing process, and the principles of the McKenzie dysfunction model specifically forcing adaptive changes to the tendon, i.e. Wolff's Law, we have found that this method properly addresses the underlying pathology and allows for a faster recovery time. Utilizing these principles of the McKenzie dysfunction model and the philosophies of the Astym treatment, we have a high rate of success with the treatment of tissue dysfunctions throughout various regions of the body, as evidenced by the rapid improvement in their functional outcome measures, including the oswestry, the NDI, upper extremity and lower extremity functional scale scores, as listed here with the patient's initials, their diagnosis, their time frame and visits, and their improved functional scores.
Now we'll run through a demonstration of the combined treatment using the McKenzie dysfunction model and the Astym treatment. Our patient will have the diagnosis of medial epicondylitis. Typically, we'll want to start with a brief warm-up to get the tissues moving. Since our patient's diagnosis is medial epicondylitis, we'll start with the upper body ergometer. We'll typically do a 6 to 10 minute warm-up just to get the tissues moving, increase blood flow, vascularity to the area.
It's most efficient by having the patient drink a VSO while having the Astym performed.
Do you want the cloth there or no? Okay.
I'm fine.
Okay, let's go block it. Alright, so since the patient's diagnosis is medial epicondylitis, we're going to obviously go over that area with the Astym tools, but we will also go through almost the entire kinetic chain due to the fact that if one structure is affected, typically the area above and below are also affected.
No.
Most patients are dying. You actually have really good tissue quality. Just in case you want to cut something else. Good enough?
Yeah.
Or more?
That's pretty good.
Okay. I want to let the patient know that since you are trying to break up the scar tissue adhesions, they may have some bruising or possibly a histamine response where we're breaking up some of the tissues that are typically affected. So it's nothing to be concerned about. It's a typical response to the treatment. The bruising is not typically painful. It just may appear the day after due to the fact that we've broken up some of the capillary beds from the angiofibroblastic hyperplasia, where we're breaking up the tissue and there's some leakage.
Is that it?
That's correct.
Okay.
Following the Astym treatment, we will have the patient begin ballistic stretching. With the Astym course, they recommend static stretching. However, the McKenzie course recommends more ballistic loading, ballistic stretching for more adaptive changes to the tissue. So we typically have our patients do repetitions of 30 or so ballistic stretches. So stand up, and you're going to go just put load through it. On, off, on, off. You feel stretch to the medial condyle.
Yep.
You do want to note the patient's pain response. If this is causing a large increase in pain, maybe not have them go to the end of the range, but there is some pain associated with this as we're still trying to make the tissue adapt. The next phase, we will begin functional exercise. So we are trying to make the tissue respond. Make the tissue to respond to the movements that the patient will be going through typically throughout the day or with their work or return to sport. So, any towels up here? So low level wrist extension and wrist flexion. From the distal end. That's hard. Now go down. Ulnar and radial deviation. This patient is exceptionally strong.
And then do
Let's go like this. How do I lower it slightly? Let's go like this. A variation to ulnar radial deviation. Pronation and supination.
This patient's wrist is about to snap.
That's good. No. We also use the Paramount and do some tricep extension. And bicep curls. P&F patterns. P&F patterns.
Try not to hit yourself in the face.
A pitching motion. You can add eccentric control. Ball walkouts. Depending on the patient's daily activity and occupation, we'll prescribe them with certain resistance exercises, but we always give them a stretch to maintain the elasticity and elongation of the tissue that we've just been working on. If the patient has an occupation that requires them to do repetitive stress trauma to the area, we may not have them do nearly as many repetitions as if they had more of a sedentary lifestyle.